Terry Fricassa. Ah. I have my glasses on.
Hi, thank you, Chairwoman and members of the committee. My name is Terry Fricassa. I represent a compassion center known as Summit Medical Compassion Center on Jefferson Boulevard in Warwick. And up front, I just wanted to express the opposition to Bill 5865, and I would like to express concerns with Bill 5555 as it's drafted just due to the landscape that exists nationally right now in Rhode Island and what our experiences have been over the past 6 years, and me specifically in the New England region. I was involved in this industry going back to 2010 at the very beginning, and I think I can answer a lot of the questions that answers were not given towards. For example, somebody had asked how states determine the number of compassion centers. I know that because I was involved with many of the states back in 2010, and it came with geographic dispersion in addition to talks with the United States Department of Justice. For example, Rhode Island probably has the most compassion centers given its landscape and population. New Hampshire, 9,400 square miles, 4 dispensaries. Maine, of which I'm involved with 50% of the market there, 35,000 square miles, 8 dispensaries. Connecticut, 5,500 square miles, 6 dispensaries. Rhode Island, 1,200 square miles, 1/30th the size of Maine, and very small compared to the other states, 3 dispensaries. But before I got involved in this business, I was more concerned with the United States Department of Justice, because back then, I personally received a letter from the United States Department of Justice stating that I was abetting and aiding in a federally unlawful activity. I would be subject to forfeiture of assets, incarceration, and jail time. I'd not only received that, bankers received it, landlords received it, other people received it. And it became very clear to me as I dealt with the other states that there was a big difference between how things were being developed east of the Mississippi versus west of the Mississippi. And the clear message was, if the licenses are limited, proliferation does not occur, state regulations are strict, we're going to abide by that. If, however, things are going to continue with what you see in the medical programs west of the Mississippi, you will see DEA enforcement action, federal action. And when I look back the last 6 years, the New England states took that to heart and developed a medical program that has actually become the standard for the rest of the United States to follow. Simply because if you look at the last 6 years, have you seen a licensed facility subject to a DEA or federal action law enforcement matter? Now compare it to out west. In terms of pricing, I can tell you that Rhode Island pricing is lower than any state in the New England market. I'm in Maine, so I know the pricing in Maine. I know it in Connecticut. I'm in Massachusetts. I know it in Massachusetts. It's very low. The issue, however, with the lowering of price, and there was mention about competition, it's a balancing act with these type of facilities. As price comes down, you wind up seeing issues that occur out in Colorado. You start seeing people cutting costs to just cover their expenses, and you see quality control start to diminish. You see products that are laced or sprayed with certain matters. You see security start to deteriorate. You can go right now to the states of, and every time there's a new state that develops, everyone's saying they're the gold standard, but if you go to Nevada right now, you could buy any license there for $1. If you go to Illinois, most of them are out of business. If you look at Colorado, most of them that existed 4 years ago are gone and no longer exist. And in my interactions with the United States Department of Justice, it was also made clear, and I see it, greater the number of licenses and the greater the proliferation of these entities, the stronger the attraction is for the black market to spring up amongst them and take root. Rhode Island, for me at least, compared to all the other states, has the fiercest competition because it has the biggest black market. And I'm not saying that theoretically. I know. We're in the business of purchasing from caregivers. I know what the activity level was out there. So our prices are really driven by the black market. In terms of the variety of strains, we currently have 12 to 15 different strains. You combine that with Slater, probably with Greenleaf, you're probably up to 36 strains. With the cultivation license holders that are coming on board, you might be up to 100 different strains. But if you're still talking about strains and different strains to deal with ailments, you're really, really behind the 8 ball, and you're really years away, because right now nobody's beholden to strains anymore. With chemistry and processing, you can isolate the various cannabinoid compounds, you can strip out terpenes, you can strip out THC, you can add CBD oils to get the exact ratios that you want and dose it and have the right combination to address 99.9% of the ailments that are out there. So I just wanted to bring that to your attention. But just to give you a little brief background of where the Compassion Centers, and particularly Summit, stands, I would be remiss without going over the last 6 years, because it was only 6 years ago that this fledgling program began. But as I mentioned to you, the letters came out by the United States Department of Justice. The program 5 years ago was shut down for a year. Then there was a change that you could only have 99 plant limits. So people had bought facilities, rented facilities to accommodate for large grows, and they had to scrap those plans. Then all of a sudden the 99 plant count limit was lifted. So then you had to scrap those plans, and you had to pour more millions into infrastructure to build out facilities that could accommodate a greater number of plants. Now the caregivers no longer can supply to the Compassion Centers. Cultivation license holders can now sell to us. I've heard, and I'm not sure, that there's up to 40 applications that are pending. So if you count the amount of capacity that they have with us, it's very clear that the supply greatly exceeds demand. DOH no longer oversees us. The change has been made for DBR. DBR now has new regulations. So I'll be honest, from a business standpoint, it's been very difficult to catch our breaths and to have our foot on solid ground. We have been, we have adjusted to all of those challenges, but it's been taxing. But at the same time, we've accommodated thousands and thousands of patients, and like I said before, the supply has exceeded demand. With respect to legalization, it's not that I'm opposed. I just express concerns, because legalization is going to be scrutinized the same way the medical program was as well. And I have been out west, and when you go out west, you do see the youth access, which has soared. I mean, I'm dealing in Maine right now with a referendum that was passed that created legalization. The number one issue, there was no prohibition on youth access. So now the General Assembly is grappling with youth access and youth access to it. I mean, a bill will be passed, but that's just one example of many that has to be really thought out. You have states that have sued each other. Colorado has been at the end of that. You see the DEA and federal actions continue to occur. You've seen them most recently just a few weeks ago in Colorado. You have a United States Attorney General Sessions, who's already made his position felt pretty strongly. That is very similar to where things were in 2010, when you saw the big crackdowns occur, and you saw the letters go out. So being in Maine and being in Massachusetts, they're really struggling and grappling with legalization. They have committees. Nothing's happening soon until they vet all of these issues. But the difference between those states and Rhode Island is they had referendums imposed on them that they had to react to. And that's what has them in the jackbox. Rhode Island has the luxury of time, being able to study the issues and the implications, throughout the country, but particularly in the neighboring New England states. Like I said, with the expansion of licenses, to the representative's point, it will, I don't think anybody, if you look at it from a competition standpoint, that's not the issue. I guess from a public policy standpoint, what have you seen in terms of a proliferation of licenses in other states? And I mentioned those states to you. I've mentioned Nevada, I've mentioned Illinois, and you can look at them and you can see what's occurring in those markets right now. And it's a disservice to the patients. It's resulting in companies that are going out of business, and it's not representing a success story in any manner. I continue to look at Rhode Island, particularly with the regulations that have been put in place by DBR, as being a standard bearer for the country to follow. I receive calls. It's been in the Providence Journal. People from Slater, people from us. We've been consulted, and we've gone out there because people in the other parts of the country, particularly in California, they come and they say, Rhode Island's doing it right. New England's doing it right. You're controlling it. You're regulating it. You're limiting it. And it's not seeing the chaos in the federal enforcement action and the patient to service that you're seeing out west. So I think that we have a very good model here. It doesn't mean that it can't be tweaked. It doesn't mean that we can't continue to move it in a better direction. But right now, I can tell you that supply definitely exceeds demand, and especially with the cultivation licenses that exist. I'll be honest, my biggest thing with the new cultivation licenses is I don't know how all of them are going to stay in business, because there's so much supply right now, and if you have 40 people that are sinking millions into cultivation facilities, where can they sell the product at the end of the day? But that's a business decision that they have to make. But Rhode Island and New England has proven to have worked extremely well. They should be proud of themselves, and they should probably approach legalization in the same manner they approach medical. Study it, get it right, roll it out in a manner where it's not going to be a problem in terms of federal laws, safety for patients, quality control, and again, for the reasons I previously stated, I continue to be in Summit as opposed to the bill to expand the facilities from 3 to 6. So that's my testimony.
Thank you, Mr. Fracassa. Representative Filippi.
Thank you, Madam Chair. I'm really interested in your analysis of supply and demand.
Sure.
What is your percent of unused capacity at this point in your facility?
Right now in our facility, probably operating at 70-80%.
Okay, 70-80%. So if 20% more volume came through the door, at that point, would you not be able to handle those additional customers, or would you have to change your operations to become more efficient?
In 5 months, we could scale to produce 50,000 pounds a year.
And so is the limiting factor the supply, your suppliers, your wholesale suppliers, as opposed to the ability of your facility to move volume, and I mean the volume of customers through?
Well, the limiting factor is demand. So right now, I think the facilities are experiencing really oversupply versus the demand that is out there. With the new cultivation licenses coming on board, I think there'll be excessive supply. Now, I can't provide you the answers as to why. I can speculate because I am active in Connecticut, Maine, Massachusetts. I can tell you that the black market is our fiercest competition. It's rampant, and it's the biggest of all of the New England states. I mean, it's just a fact, and I think law enforcement, whether it's at the state or the federal level, will concur with that.
And so you're at 80% capacity because of your ability to obtain product to sell, or you're at 80% capacity because of your facility's ability to process the raw wholesale and move it into a form which can be purchased by a consumer on the street?
Right. So, as a business, you don't want to have excess inventory because it becomes degraded, it's a cost, And also you have incremental cost in terms of further electricity, further lights, further labor. So what we do is typically scale according to what the demand is, but be in a position to scale. So if we see that the demand is increasing, then we will continue our expansion. No different than what we've done in Maine, for example, by starting with 10,000 square feet and going up to 60,000.
So at your current operation, it's 80%. You can scale that up to serve many more customers, many more patients.
Correct.
Okay, thank you.
You're welcome.
Representative Vella Wilkinson.
Thank you, Madam Chairman. Terry, over the years, you have had home growers or the cultivation growers supplement your inventory, didn't you, as you were waiting for your growing center to get to full capacity?
We did.
And so what percentage of that stock would typically be rejected because it didn't meet the quality standards of the Compassion Center?
Well, actually, some caregivers, I have to say, are quite good, but there was a great percentage, maybe 30, 40%, that upon the type of testing we do, even with mass spectrometry, which would test heavy metals, you would detect mold, you would detect heavy metals, and we just couldn't purchase it. And a lot of that is not beholden to the eye. On the same token, we simply can't deal with caregivers also when we understand, and I'm not naming names, but, when there are caregivers that approach us and say that they want to supply us with their excess inventory, but out of the same breath, they said that they've made $1.4 million in cash the previous year, then I know that person will never be satisfied in terms of selling to a compassion center at a price and at the limits that we're allowed to purchase. So we have had to turn away a number of caregivers because of that issue as well. So it's a limited number of people that you can rely on, but I've seen tremendous progress over the last year with what the state has done, with what DBR has done. It's been very good working with the current cultivating license holders, but I have to say that a lot of the patients, a lot of the caregivers are very professional, are very good, but like everything, you always have bad apples mixed in.
So who is it that is responsible for doing on-site inspections to check the water runoff, to see the mold, the THC levels, the heavy metal levels? Who actually does that?
Yeah, well, there were a number of third-party testers in Rhode Island. The laws have changed, and now they're going to have independent third-party verification, and the laws are still coming out on that. However, we just decided that we are going to invest in internal quality control. So if you see our facility in 3 months, we'll have close to $1 million state-of-the-art processing facility that does extraction, meets ISO 7 certification. It's at the level of a Merck, cleaner than a hospital operating room. We will have an independent lab that will be equipped with HPLC, GC, mass spec as well. Not that we can rely on that because we have to send that out for third-party verification, but we take it upon ourselves when you see what's happening elsewhere. We just want to make sure that these are, these patients who are coming in, you have to remember, they're patients, and that's been the biggest eye-opener for me. I came into this industry not a believer, and right now, I can tell you I'm the biggest believer in it. Priests have come in with sisters and mothers. Law enforcement people have come in with brothers and sisters. People have come in with 6-year-olds that are suffering from seizures. So these are patients that are taking these products. And you have to remember that it should be treated and scrutinized and regulated the same way as any other product that they would take, whether they're buying it from CVS or elsewhere. So that's a corner that you just can't cut, and you cannot cut security. You cannot cut those other matters as well. And that's the only problem when you see price wars occurring. You see people starting to cut those costs, but in the end, that fails, and the only people that wind up getting hurt are the patients.
Now, unlike the cultivators, the typical cultivators that are in various residences throughout the state of Rhode Island, you and the other compassion centers actually offer wraparound services as a medical center. Could you talk a little bit about that, please?
Sure. We kind of view ourselves as a patient-oriented facility, meaning that we've had in our facility numerous seminars. We've had a women's series with women who've had various cancer, breast cancer and other forms of cancer, and they've had roundtable discussions in the past that have gone for 2 months. We've had cooking lessons. We have people that have come in and have talked about other ailments and other advancements in medical cannabis, particularly alternative dosage forms in treating various ailments. The vast majority of our patients are older than 45. Of them, the vast majority that we're finding are coming over for the first time and using this product and turning their backs away from opiates, or they've been on opiates but they don't like the side effects. It's not helping them. So when they come in, the thing that we were lucky to do, but we should increase more, private rooms, because it was amazing how many patients come in, but they want private consultations to really talk about their ailments, understand what types of medicine would best address their symptoms, and then they come back and give you feedback as to how they feel, how it affected them one way or the other. So there's a lot of private consultation going on as well. We also have a full-scale library in which people can come in if they ask for any type of research materials, any education. We have print materials. We've got website materials that they can access. If they want to speak to individuals, they can speak to individuals. If they want recommendations as to other holistic medicine practices that are out there to help complement or cope, allow them to cope with pain, then we have a list of different people, whether it's Reiki, acupuncture, or whatnot as well. So it is kind of a comprehensive service that we provide, and it's been a very heartwarming and rewarding experience for me to be involved with the Compassion Center. And it's changed my views on a lot of things, and I've got family members that are using it for health purposes and for medical reasons, and so I'm a firm believer, but the patients are the number one priority.
Thank you, Terry.
Representative Hagan-McEntee.
Thank you, Chairwoman. Terry,
Yes.
just for my information, a short question. So when a patient comes in with a prescription from a doctor and a medical card saying they can have marijuana, do they know exactly what type or strain? You said you had like 30 different varieties.
Well, that's probably total with the 3 compassion centers, but okay.
Do you determine that, or does the doctor determine that, or?
Unless a doctor is very, very aware of medicinal marijuana, in large part, it's up to the professionals at the Compassion Center to educate the patients. Some patients are very knowledgeable, representatives, so they come in and they do request a certain strain, or they do request a certain alternative dosage form. And what I mean by alternative dosage, most of the people, the big trend is not to really smoke flower. It's to take it in alternative forms, capsules that are filled with liquid or powder, tinctures with drops that are going underneath the tongue, transdermal patches, vape cartridges, vaporizers, and then typical edibles, things like that. So in large part, though, I would say the majority, especially the new people that are coming on, they don't know what to take. So it depends on whether they need it for increasing their appetite, relieving certain pain, allowing themselves to sleep, a host of different reasons. And a lot of times you make the best judgment, but then you work with the patient so that they can find something that is best for them.
So it's a little trial and error
Yes.
when you first start.
And
Thank you.
everybody's a little bit
Right.
different too.
Thank you.
You're welcome.
Thank you, Mr. Percussa.